Mayor Alig, good morning.
Half a day, good morning. Deputized sounds so
Sounds official, right?
yeah.
Well, it sounds
Well,
a lot
I really
better
don't, I
than
won't take too much of your
Toggle.
time. I just wanted to just kind of go over what we're doing and be clear so that residents are not alarmed when the mayor's offices are giving them a call. So again, it our efforts are really only going to be through Monday through Friday from 8 a.m. to 8 p.m. So residents will receive a call from the mayor's office staff or one of our volunteers, and we're not asking any personal information. So if there's no personal information that's going to be requested whatsoever, it simply is to inform the residents that there is COVID testing available and that it is free, and that if you're insured or uninsured, you're able to get tested and seen medically. Our push really is to identify or to help residents identify whether or not they are COVID positive. Because if you're positive, you'll need to get checked right away. And again, we are part of this effort simply because the most recent rise in deaths on arrival and hospitalizations occur from with residents or patients who are not symptomatic, and so they don't know that they're COVID positive, and their end result is not, does not fare well. So we want to help residents identify their status so that you know whether you need to get checked or not, whether you need medical attention or not. And so it is important for residents to get the message. So what is different from all the other things that are going on in this pandemic? The biggest difference is that we're not only phone banking, but we're also trying to address those isolated areas and those difficult to reach residents. Because not we see every day we see the JIC releases, every day we see new videos and we see new flyers coming out about the pandemic. But there definitely is a population on the island that does not receive those videos and those flyers.
Yeah.
And so we're trying to reach those people. And that's our effort, really, is just to get the word out to those people. Um, and hopefully it lowers our numbers of deaths on arrival and our hospitalizations. I mean, you know what the news is, and I wanted to come on because uh, I was just hearing KOM saying that we're coming up with the mayors will release their plan soon, and I'm thinking, no, we already have a plan. And so I think people are just replaying that, and I'm hearing it over and over again. And I would like the listeners to know that we have already started calling since the weekend, and it really is not to ask anyone any information. It's just to inform you of our testing sites that are available and the tier 2 clinics. And we want to be clear though about the tier 2 clinics, because we know that Tizen lines could be long, the lines in Alahan could be long. If you are insured, you certainly can go to AMC, FHP, or SDA and get a COVID testing there for free. There is probably an administrative fee that will be assessed, but billed to your insurance, not to the resident. Again, we just have to continue to push that out, that the resident will not and should not pay for a COVID test. And the tier 2 clinics are available. Let's use them. I know there are many questions about, will the government turn up other testing sites?
Yeah.
I don't know, but what is available, I think we need to utilize it to the fullest extent.
Yeah. But
And
Mayor,
so we're really hoping, yeah.
I know your effort is to reach these people, so you're going to call them and basically, can you kind of go through what the phone call will entail? Because I know when we had you on, it was just yesterday, you were talking about the possibility of offering testing at the mayor's office, but now it kind of seems like you're going to be calling these people and saying, hey, how you feeling? Oh, you have sniffles? Well, go get tested over at any of these, tier 2s or T-Zen or whatever.
So there's a script, and we're asking all the mayors, the staff, and the mayors included, and any volunteers that are calling, to utilize the script so the messaging is the same and uniform. The script, again, is an approved script that the doctors have seen and so that we're not sending any misinformation. We're only providing information. The mayor's offices will simply read that script to the resident. Of course, if the resident doesn't want to listen to it, that they have the option to just hang up. But we want to be able to just communicate that to them and correct. The offices will not be administering any testings at this point. Okay. There still is discussion as to what other options we can do, but we also have to be realistic in what we can actually execute, because there's there's a lot going on. Yeah. I mean, even in the phone banking, with the phone banking, I mean that's difficult in itself. I mean, especially whether you're a small village or a larger village, it takes time to do the phone banking, and so we won't. And then of course it takes up our lives, right? So you might see a call from a cell phone number, which is going to be okay, because it'll probably want to be one of our cell phone numbers, because we don't want to utilize our landlines. But just know that we will identify ourselves from the mayor's office, and that it is only Monday through Friday from 8 a.m. to 8 p.m. And we will not be asking for any information. We won't even ask if you're insured. We're not asking any type of information at all whatsoever. If you're feeling sick and you have questions, we can give you the answers that we do know, that we're positive about. Other than that, we will offer you the number to the JIC so that you can call JIC or 911.
Mayor, I have a question, because you mentioned very early on mayor's office staff or volunteers. If there are any people in the community who may say, I want to get involved because I realize I live in a very large village and it's going to take some time, or they may say, I've got call center experience, I've done telemarketing, I've done tech support and everything like that. If people do feel a need to help out and everything like that, how are they able to do so?
Yes, please reach out to your mayor and see if your mayor needs help. More than likely, all the mayors will need help, because again, it's just additional duties for us. So we're making it all work. But if you are a volunteer, like you said, Jay, please give us a call. We'll use whatever help we can get. Of course, we have to be careful with who we share this information with. We aren't really sending out our database to volunteers. So it is, there's some sensitivity to it as well. But yes, please, if you want to volunteer, call your mayor's office to see if you can volunteer to phone bank. Or if it's not to phone bank, perhaps it's to do something in lieu of phone banking, so that the staff who is phone banking could do the phone banking.
Many hands make light work.
The mayor's office will help. Yeah.
Mayor, what are you going to do in situations where, because you mentioned it, some people, they don't have access to videos, social media, and all of that. Maybe there are residents, a lot of people that probably don't even have phones.
Yeah.
So how are you going to go out and reach out to these constituents?
Right, and so that's part of our effort as well, is to identify those isolated and difficult areas and to go out there. And so that's why we can't. Our entire staff will not be phone banking. We'll probably have a couple people in our offices phone bank, and the rest will go out to the actual go out to the community with the mayor to identify those sites. So yeah, we are exposing ourselves to those situations. So we will be going out to those areas. Again, public health has, like in the north, public health has done rapid engagement up in the north, right? And so they know those areas. We just need to revisit those areas, because if you've only been tested once and you were tested last year, you need to get tested again, right? And people just need to continue to know that they have to continue to be healthy, and we need to make sure that they know that they can actually go get tested for free, insured or uninsured.
Right.
So yes, what's different from everything else is that we're trying to do, we're approaching this differently by phone banking, because not all people actually are on social media and have WhatsApp access or Facebook. So hopefully those people who have phones, without those types of capabilities will get the information. That's one. And then the second is to get out to the difficult areas, like you had mentioned.
Are you guys getting any additional funds, ARP money or anything like that, to pay for the cell phone bill for this, or gas to go out and do this face-to-face knocking on doors thing? Any kind of additional funding? I mean, it was the governor's office, right, that approached the mayors.
I'm looking at a sign. every time you talk about it, I think about what I'm gonna do. So I'm looking at a sign across me. It's a little thing, and it says, "I'm busy." I want to run over there and get it and put it up here. No. There's no. We have not talked about any additional funding for any of that, any reimbursements whatsoever. At this point, after listening to the doctors, for me, that doesn't matter. After listening to the doctors, what matters is to get the word out and let people know that they need to get checked if you're coughing, if you're sneezing. Yesterday, I had a resident who said, "Oh, I just had the sniffles." Oh my gosh, get in your car and go. And they went straight to a clinic, and they were negative, and that's fine. At least you're negative, right? But the simple cold, the simple flu-like symptoms can probably lead to something worse. Can lead to an unfavorable outcome, and that's what we were seeing most recently with the death on arrival. So that's what we want to prevent. So no, I know you'll continue to ask those questions, but at this point, no.
Yeah, I hear you, Mayor, that it may not matter, but it does have an impact because we all know that Mayor's office staff, they don't make a whole lot of money. And them sacrificing their time, even risking their lives to go door to door, they don't know what they're going out into. And so that's why I kind of bring that up, because somebody's got to speak for them.
I want to bring up the although you're not getting any financial resources, what about like manpower resources? Because you mentioned the rapid engagement team, right? And so if you guys don't remember the rapid engagement team, it was like the strike force of public health, and they would go into these areas where they felt there could be a cluster, or through contact tracing there was a significant number of cases, and they would basically go into these areas like Santa Ana and Derrida and test everyone. So basically,
right.
what we're doing now is we're just asking you guys to call everyone in the village to go knock on these doors, to tell people to go get in their car and go get tested. Was there any conversation about, hey, we're going to do a rapid engagement team to kind of supplement the effort that you guys are doing?
So there is conversation about that, and public health is helping on the Division of Senior Citizen side, and also the HSP, their vendor, their contractor, to contact their clients, which is it's a large number. So that'll help us. So they're part of our efforts as well. As far as rapid engagement, that is being considered, and it'll just be addressed as the mayor sees fit, right? So the mayors need to let us know, particularly up in the north, if they have those sites that are difficult and they're finding it, like you mentioned, the Santa Ana area, we have the Gil Breeze, Gil Baza areas, those types of things. So we will address them as the mayor sees fit. If the mayor says this is what's going to work best for that area, public health is willing to entertain that. Again, it's about resources. Unfortunately, we have to go back to the resources and what is available. I mean, there's a lot of money. I'm not sure why we can't use it.
I wanted to follow up. There was something that you mentioned yesterday, and you kind of touched on it a little bit during this conversation. But yesterday you mentioned that the mayors were going to be talking with public health regarding the possibility that mayor's staff would be actually conducting COVID testing. Is there a follow-up to that discussion on whether or not that's actually going to happen?
So they're still discerning that, simply because of first the availability of tests and other options. And so at this point, it almost seems like it's not going to happen, but nothing is for sure yet. The public health and the doctors are still discussing that. Of course, there are some mayors that are willing to do it. Others are skeptical. It's really a toss-up. I think what it is as long as we give the mayors enough information to decide on what's best for their operation, then that's where then I'd be satisfied. But at this point, again, it's still being discussed as to whether or not the offices will be able to administer the testing.
Mm-hmm.
We did request, though, for additional testing sites in the villages. So what we informed public health is that the offices, the communities have facilities for them to stand up additional testing sites in the villages, and that we are open to having more testing available in our communities.
And just to go
That's what
back to
we're
the going door to door, you mentioned no funding, but what about like PPEs, things like that for staff at these mayor's offices that have to go out into the community and go door to door? Is that going to be provided, or has it been provided?
Well, it has been provided. We have a boatload of PPEs.
Okay.
Yeah. Thank you for asking. And I really do appreciate you standing up for our staff. And quite honestly, they hear you because we get it all the time. So, and I get it. And you know, as much as you mention it, I get it as well. Just so that you know, we will be submitting our COVID timesheets. whether they will be paid out or not, we're not sure, but we will be submitting them. So that was the latest from DOA. So thank you for your advocacy.
Of course, of course.
Yeah.
Thank you, Mayor.
But that's all. Thank you for allowing me to come on. I just wanted to share that because, again, residents, you know, they listen to your show because we get it all the time. But just be aware that, you know, the mayor's offices or our representatives will be giving you a call. And it only is Monday through Friday from 8 a.m. to 8 p.m. And if you don't wish to get a call, simply hang up and we'll be fine. But thank you so much.
Thank you,
Thanks,
Mayor.
Be safe.
Okay.
Yes,
You too.
there you go. Mayor Alig, the president of the Mayor's Council. We did have some comments here. Dwayne Santos comments, and it's true. I received my call yesterday. You just need to listen. It's very informative. What else we got here? Gina comments, just drive an ice cream truck through the village and hand out flyers. Everyone runs after the ice cream truck. Create large banners to hang at major village intersections to advertise the need to go get tested and where to go. Dwayne Ginini Corazon Nija, God bless the mayor's office. This is Guam culture and belief.
And you know, like Mayor Alex said again, if you have experience doing phones, you may have volunteered in the past for, you know, the holiday hotline. Several of us here at KUM have. And even if you have no experience, if you just feel a desire to get involved and help out and help canvass your village, you know, your hometown and everything, give your village mayor's office a call, and they'll talk to you about how you can contribute.
Gina, again, with another great comment. Do another cash raffle for those getting tested. Every person gets a ticket. They will show up.